This video will discuss about how to analyze CSF findings in meningitis. Meningitis is CSF infection. So by cerebrospinal fluid examining, we can get to know what organism is causing infection so that doctor can treat that patient. So decided whether it is bacteria or viral meningitis. Viral meningitis is also called as aseptic meningitis, or it is granulomatous meningitis. Um, Granulomatous because of mycobacterium or fungal infection, fungal meningitis. So the component we take here, total number of cells, total number of cells and glucose amount in the CSF, protein amount in the CSF, and opening pressure while doing lumbar puncture. So here what are the component? We take total number of cell, glucose, protein and pressure. So normally less than 5 cells will be there. Glucose quantity will be 2/3 of blood glucose level. Protein will be 15 to 45 mg per deciliter, and the opening pressure normally will be 70 to 180 millimeter of water. Bacterial meningitis, that neutrophil predominant will be there. Neutrophil predominant will be there. More than 1000 cells will be there. Neutrophil predominant will be there. Blood glucose level will be decreased because bacteria feed glucose, and protein are increased, and opening pressure is very high. Opening pressure is very high. Aseptic or viral meningitis, 1000 to 100 to 1000 cells will be there. It will be lymphocytic predominant, glucose is normal. So lymphocytic predominant, glucose is normal, protein may be normal or increased, and pressure also will be increased or normal. In this viral aseptic meningitis, neutrophil 100 to 1000 predominant, blood glucose level normal, this protein normal or increased, pressure also normal or increased. Then just bacteria feed the glucose. Okay, next coming to granulomatous meningitis, here also cells will be 100 to 1000. It is lymphocytic problem. Then how to differentiate we'll discuss in the next step. So here glucose will be increased, protein will be increased, opening pressure will be very high during lumbar puncture. So next, how to decide whether it is bacterial or viral or granulomatous. So do lumbar puncture, draw CSF, look WBC, that is leukocytes count. So if that leukocytes are less than 5, it is not significant. We can leave it. If the leukocytes are very much increased, 100 to thousands, so then see whether it is neutrophilic predominant, that is polymarbonuclear predominant, or lymphocytes predominant. If it is neutrophilic predominant, as first earlier is said that bacterial or number will be very high up to 9,000, 10,000. If lymphocytes are predominant, check that glucose. If glucose are decreased, it is mycobacterial or fungal. If it is normal, it is viral. So in bacteria also glucose level decreased, and fungal mycobacterium also glucose level decreased. Protein are more or less or normal. In these meningitis, this kind of cases, we also send CSF for culture and KOH mount. Cryptococcal antigen. If to find any cryptococcal antigen, tuberculosis culture, so that we can know what type of organism is there, so doctor can treat patient easily. CSF analysis in meningitis. It is a CSF infection. Meningitis is the CSF infection caused by bacteria, virus or granulomatous, mycobacterium or fungus. Then what are the component? Total number of cell, glucose, protein and pressure. We want to take normal cell less than 5, glucose level 2/3, blood glucose level, protein level 14 to 45, pressure 70 to 80. Bacteria means neutrophil increased, blood glucose level decrease, protein and pressure level increase. Virals means lymphocytic is predominant, glucose normal, protein normal or increase, pressure also normal or increase. Granulomatous, here also lymphocytic, here glucose level decrease because bacteria will feed that mycobacterium or fungus will feed. Then protein level increase, pressure level predominantly increased. So we do lumbar puncture, draw CSF, look WBC. Leukocytes less than 5, not significant. If increases means two things we want to check. Polymarbonuclear predominant, lymphocytes predominant. Polymarbonuclear means bacteria. Lymphocytes means we want to check glucose. Glucose decreases in the case of mycobacterium or fungus, normal in virus. Protein, some cases protein increases or decreases are normal. In these cases we can send CSF for culture, KOH mount and this kind of test. So based on that only doctor find out what type of organism and what are the treatment. Thanks for watching.